Hello and welcome. So today's topic is our mediastinum. This is very important and very special topic for about your MCQ based exams and Viva and theory exams. Anyway, so this is basically a space, a open area or a gap area in between both lungs. Okay, I mean right lung and left lung. So you have to know about the boundary. The overall boundary of the mediastinum is upper part. It is bounded by the thoracic inlet, as you can see in this photo, and below, I mean inferiorly, it is bounded by the diaphragm. Okay, each side you're gonna find right lung, left lung. I mean the medial part of the lungs covered by the pleura. Which part? Lung has two pleura, visceral, parietal. Parietal is outside, so you're gonna find parietal pleura of each lung along with the mediastinal pleura. I will talk about this now. Anteriorly it is bounded by the sternum, okay, and posteriorly by the vertebral column, as you can see in this photo. So it is overall basic boundary, and it has two parts: overall superior part and inferior part. Inferior part is divided into three sub parts: anterior, middle, posterior. Okay, so now I'm going to talk about superior mediastinum. You have to know about the boundary of the superior mediastinum. It is bounded by the anteriorly manubrium sterni. As you already know about the sternum has three parts: manubrium sterni, body of sternum, and xiphoid process. So ignore the body and xiphoid process. Concentrate on the manubrium sterni. It is covering the anterior part of the superior mediastinum. It is bounded superiorly by the thoracic inlet, posteriorly by the four thoracic vertebrae T1, T2, T3, T4. Now, each side it is covered by the mediastinal pleura along with the parietal pleura of the lungs, and inferiorly it is bounded by the, see, I told you in sternum part that the joint or the connection in between manubrium sternum and the body of sternum, there is a little bit angle, we call it angle of Lewis. Okay, now an imaginary line from the angle of Lewis to the T4 or the fourth thoracic vertebra, this imaginary line acts as a boundary of the inferior part of the superior mediastinum. Okay, now one thing, this angle of Lewis is also known as sternal angle. So whichever textbook you are following, so don't confuse in my words and your textbook words. Okay, now in the content of the superior mediastinum, you're going to find first of all muscle group. In the muscle group you will find the sternohyoid muscle, sternothyroid muscle, and the longus colli muscle. I mean small part of the longus colli muscle gone. In the arterial part, you're going to find arch of aorta, then both side brachiocephalic artery, left subclavian artery, left common carotid artery. That's it. In the venous section, you're going to find right side and left side, right and left brachiocephalic vein, then upper half of the superior vena cava and superior intercostal veins. And in the nerve section, you're going to find vagus nerve, phrenic nerve, left recurrent pharyngeal nerve. Okay. Now, in the major contents, you're going to find part of the trachea, part of the esophagus, then part of the thoracic duct, part of the thymus gland, then little bits of lymphatic nodes. In the lymphatic nodes, you're going to find again brachiocephalic lymphatic nodes, then tracheobronchial lymphatic nodes, then paratracheal lymph nodes. All these contents are the part of the superior mediastinum. That's it. Now the anterior mediastinum, as I said, it is part of the inferior mediastinum. Anterior mediastinum, it is actually the continuation part of the superior mediastinum and presents in front of the pericardium, behind the body and xiphoid process of the sternum. Okay, it is little bit overlapped by the both sided lungs, I mean the anterior border of the lungs. Okay, each side again mediastinal pleura along with the parietal pleura of the lungs. Inferiorly it is bounded by the diaphragm, and superiorly it is bounded by the, as I said just before, that imaginary plane in between the angle of the sternum or the sternal angle or the angle of Lewis to the fourth thoracic vertebra. Now again, the contents of the anterior mediastinum. First of all, sternopericardial ligaments, few lymph nodes and lymphatics, small mediastinal branches coming from the internal thoracic artery, both sides, okay, right side, left side, and lower part of the thymus along with some areolar tissues. Okay, so anterior mediastinum is not so important for your exam purpose or your Viva practical purpose, so you can ignore this. Okay, now the posterior mediastinum, it is also part of the inferior mediastinum, and you know about this, but you don't know about the boundary. It is bounded by the anteriorly pericardium, posteriorly 8 vertebra of the thorax, 8 thoracic vertebra from T5 to T12. Okay, T5, T6, T7, T8, T9, T10, T11, T12. So all these 8 vertebra making the posterior boundary. Now, each side again the same mediastinal pleura along with the parietal pleura of the lungs. Okay, now you have to know about the contents. In the contents, in arterial section, you're going to find descending thoracic aorta and its branches. In the vein section, you're going to find azygous vein, hemiazygous veins, and their tributaries. In the lymphatic section, you're going to find posterior mediastinal lymph nodes along with the thoracic duct. In the nerve section, you're going to find vagus nerve, splanchnic plexus, and the sympathetic ganglia. And in the major structure, you're going to find pulmonary vessels, the pulmonary artery, pulmonary vein, esophagus, and the bifurcation of the trachea. So, this is the overall content of the posterior mediastinum. Now, the middle mediastinum. So, about this, I already talked about the anteromediastinum, posterior mediastinum. So, in between the space is known as common sense middle mediastinum, which is each side bounded by the mediastinal pleura and parietal pleura of the each lung, right lung, left lung. Now, superiorly it is bounded by the imaginary line present in between the angle of Lewis to the T4 vertebra. Same. And inferiorly diaphragm. In the contents, you're going to find same to same. In arterial section, you're going to find ascending aorta, then pulmonary trunks along with the true pulmonary artery. Okay. In the venous section, you're going to find right and left pulmonary vein, then terminal section of the azygous vein, and the lower half of the superior vena cava. In the nerve section, you're going to find phrenic nerve, then vagus nerve, and in the lymph node, you're going to find tracheobronchial lymph nodes. Also, you're going to find bifurcation of the trachea and right and left main bronchi. Okay, so bronchi, bronchioles, I talked about these things in earlier videos anyway. So overall, now you know about the entire mediastinum. Okay, so see you soon with my new topics in my next video. Till then, bye.